Hi, my name is Dr. Sahil Gaba and I work as a consultant orthopedic hip and knee surgeon at Amrita Hospital, Faridabad, specializing in robotics and trauma surgery. On the occasion of World Osteoporosis Day, I would like to share some important information on osteoporosis which will help you to lead a long and healthy life. Osteoporosis is a disease of the bones which results in reduced bone mass and thereby increasing the risk of fractures called as fragility fractures. The disease affects nearly 1/5 of the world's population. It is also called as a silent disease because the fractures can happen even without any prior symptoms or any prior warnings. Broadly classifying, the disease is classified into 3 basic subtypes. The first one is postmenopausal osteoporosis, which happens in women after they achieve menopause, and it is due to the deficiency of the hormone estrogen. The second common subtype is age-related or senile osteoporosis, which happens both in men and women beyond the age of 65 to 70 years. The third common subtype that we see in our practice is secondary osteoporosis, which happens as a result of certain underlying medical conditions, for example, rheumatoid arthritis. It can also happen secondary to certain drugs, for example, steroids. Osteoporosis leads to fragility fractures. These fractures commonly occur as a result of low energy trauma, for example, a simple fall. The common sites of fractures include spine, hips, wrists and shoulders. In my practice, I come across hip fractures very commonly, and these fractures can be associated with significant morbidity and mortality. These fractures will almost always require surgical intervention in the form of either fixing the fracture or in the form of a joint replacement procedure. And the whole aim of the treatment is to make the patient mobile immediately after surgery. Along with this, we will investigate osteoporosis and start the required medical treatment.
My name is Dr. Priyadarshi Amit. I'm a consultant orthopedic upper limb surgeon specializing in shoulder and elbow surgery and upper limb trauma. In my practice, I come across many osteoporotic fracture or a fragility fracture involving mainly the shoulder and wrist joint. These fractures can be very painful and cause severe disability. We recommend you need to see an orthopedic surgeon if you are over 50 years old with a history of fall or previously had fragility fracture, or if you are on certain medications such as steroid or cancer medication. Your surgeon will organize a simple test which is called DEXA scan to measure the bone density in your body. Based on the result, he's going to advise you either lifestyle changes to promote bone health or certain medication to prevent the bone loss from your body. Contrary to the common misconception that only calcium and vitamin D are necessary to maintain bone health, you need to take a specific medication in order to reduce the bone loss, which include bisphosphonates such as alendronate, zoledronic acid, and other drugs such as teriparatide, denosumab, under the advice of an orthopedic surgeon or your doctor. The hormone replacement therapy can be effective in postmenopausal women. However, these drugs can be associated with few risks and side effects, for which you need to stay in contact with your surgeon or a doctor. Your doctor will also assess if you need to take this medication for more than 3 to 5 years. Apart from these medications, you need to take additional precautionary measures to prevent fall, such as using the walking stick or avoiding slippery surfaces, maintaining adequate lighting in your house, or keeping a regular eye check. However, unfortunately, if you do sustain a fracture, you need to see your orthopedic surgeon. In my practice, majority of these fractures are treated non-operatively with either a plaster or a simple sling. However, occasionally, these fractures do need surgical fixation or even a joint replacement surgery. With this information, we wish you very good bone health and a life free of fragility fracture. Thank you very much.